So my topic is, and I wrote in this topic my PhD and analyzing efficient methods in the health sector. Um, in Hungary because I teach and I live in Hungary and I live in big city, and this city name not the main city in Hungary. This is the big city, 200 kilometer for the main city. This is Miskolc, and in Miskolc has it's a big city and have many people and use the health sector. And when I make this research, this was the first. When I can't search one topic and one area, when I can make my research, and I choose the hospital sector and health sector because this sector have many relevance and have many. Methods and have many data, and I can make my research. Today I will speak about my basic definition, importance and delineate of the research framework, presentation of the methodology, and I will give big practice for big and good practice for interstitial effectiveness testing. So the first is have three definitions when I was the first in my research. One was the performance, second the effectiveness, and the third is efficient. The first was the performance is the two-dimensional theory where on division related the achievement of goals and same output or outcome, while the other dimension analysis the use of research to achieve and out. This was for me the definition in my PhD, and when I make research after my PhD, this is my grand and general definition. And after, when I see the performance, I have just one question: what is the effectiveness? And the effectiveness has one definition: the extent to which the organization has achieved, and objective set. Okay, but when have two definition, come the last definition when my research was important. This is efficiency, how the result are achieved at what the cost. An activity or organization is more efficient, it is achieved the greater result with the same effort or achieved the same result with less effort than others. So this was the big question. And after, when I see the definition, I must choose which topic and which company and hospital, of course, will be make my research. And this PowerPoint show me have the performance management, the efficient of organization, and after coming the public sector because many country has public and private sector and have the mix. But in Hungary, this is general the public sector, and I choose of course the public sector, and of course I can make my research processing because have many literature in performance management that when I search, for example, the health sector management, I haven't got enough, and I see this was the gap, and this gap I can take many publication because this topic is very important. The performance management and the organization level of healthcare organization, and here is the pyramid, and the pyramid have which type of the hospital has in Hungary, and I choose the county hospitals because for me was good, and for me was very good because have many hospital can I see, and I of course I have many data. So of course we see in the geographic plan, and we see which institution I made this, and for was very important the selection of institution. This was the homogeneity. I make the presentation maybe, and this was for me very interesting. The second progressive level of care, because the second progressive level is the hospital, and this was still important, the institution within 600 and 1250 beds and 50 and 23 wards. So in this hospital have this example. But have many hospitals then have barriers because haven't got enough wards and haven't got enough, for example, beds. For example, in Hungary has special hospitals when, for example, has psychiatry, or for example, have just one ward has, for example, oncology. And not take in my research. And after, I can choose one methodology or models, but I chose one methodology, and this was the data involvement analysis. Method defines the efficient values and ratio and the efficient frontier as linear programming tasks. This is have two types. This one type is input oriented and the other is output oriented. But I think when I make my research, I can choose the input oriented because when I see the input have the hospital, the output can take the hospital and have many protests make. For example, when I see this and have many presentation and have many publication and paper in this topic, and one topic has this the very specific pursuit to identify inform useful for decision making in the healthcare institution. And for me was the main question the decision making. And I have one very interesting question because when I see the efficient, I have one conclusion: not enough see the efficient, we can see the strategy too. Because when the organization have the good strategy, and for example, I make the radar methods and the other methodology, I see when the strategy is big and high quality, the efficiency is high quality too. So this was very interesting in my topic. And after, when I make my research, I take, of course, have the EI and publication, and I made the Prisma research, and I see which input and output have in the paper when I write other researcher, not I. And after I can choose in my presentation and in my research which is the important, and I choose for input and for output. And this was very important for me. This was the par. For example, when I have number, the measure part, and for example have the output this member. For example, the first part was active hospital beds number and number of beds actually in operation. So this was the part, and after was the input the total stuff. Of course, we can measure the person, and after coming the number of patient. This is person two. So have many and many thing and many question, and after I can take this DAO methodology and have their result. This is important when somebody have their top switch record or other decision making theory. This is the most higher, and the higher result is one. And when somebody have one, this is efficient. And have, for example, not one, this is not efficient, and we can see why not efficient. And when come the strategy, because when we see, for example, I have one hospital because this hospital is not efficient, I can see the strategy because maybe the strategy is not good. And this is very important when have head of the institute and head of, for example, the healthcare management institute. This was important. The head or OC have philosophy, management philosophy, and of course performance philosophy and decision philosophy for good working for the institute. And after, when I see this, I make one conclusion and I make one big paper for in this publication. And after when my PhD in the future research, I have many goals and I have many tasks. And for example, I made nowadays international projects, sample when this, but just this private hospital. And for example, I have one international project, but this is university efficiency study. So I compared, for example, the part of the university in my university and of course the Hungarian university. And for example, I would like still one part make a research, smaller unit, for example, hospital wards. So not the complete hospitals. I would like just to one hospitals, and I would like make a research, and I would like inspection of areas. So I have many plan, and I haven't got enough time, but maybe when I have enough time, I can make this research. Maybe not past in this presentation for the section, but I would like the multidisciplinary sense and multidisciplinary part show for the section. And thank you for your attention. And when somebody has question, I have here, and I would like answer for the questions. Thank you.